This is an important article that I found published last year. It looked at, okay, so where's all the peer-reviewed literature on the use of cell phones in healthcare, and what does it show? If I may, just to highlight, you know, there was 17 studies done that had fairly good data, but they only pulled out 9 of them that had really meaningful data. And of those 9, 8 of them showed that just a simple messaging service, SMS texting, did result in significant behavior change. And this was a representative of 9 different countries, both developing and well-established Western countries as well. And so the point is that text messaging, we believe, is a tool for behavior change, and it's not anything new. Many of you already know that. Some old literature in the last 5 years shows how it's been very helpful in texting patients to promote healthy behaviors, to quit smoking, to provide better diabetes care. I'm going to show you some of our data on that, to be more attentive to attending appointments for patients, as well as now this number, there's well over, I believe it's over 5,000 apps now for just mobile health in general. But this was out of the Manhattan Research Group. They estimate that by 2012, over 80% of doctors are going to have smartphones. I think we may already be there now, but nonetheless, this was last year's data. And again, so of the 6 billion cell phones, it's important to realize that there are 3 billion more cell phones than any other electronic device in the world. Again, just to highlight the pervasiveness of this technology. There's more cell phones than computers. And so when you look at the use of cell phones in healthcare, looking at broad area networks and wireless networks, with 4G now rolling out, the whole issue of security is going to be an important issue if we're going to be successful. So what I'm going to highlight over the next few slides is to make this argument on why mobile health to me is so critical. So there's this big movement of cell phones. So already we've got something that's pervasive in the marketplace. The next big movement that's going on is the patient-centered medical home. Who here has heard of the patient-centered medical home? So you guys are already well connected. This has been going on for 10, 20 years now. The Pediatrics Association of America has been promoting this. And this particular study out of Health Affairs, it's about 4 years now, they did a survey among 7 Western countries. You can read them here, New Zealand, Germany, Australia, Canada, US. And it found that a medical home that's accessible and helps coordinate care had significantly more positive experiences. And I'm going to get a little deeper into the medical home in the next slide. But the US stands out in this study as essentially showing cost-related access barriers and less efficient care. And this was so critical, I believe, and when President Obama and the healthcare legislation passed, I know it's a contentious issue, but this whole use of electronic health records and getting providers to use that and funding and linking payment schedules to the use of the EHR, where there's rewards over time, and if you don't adopt it in the next 3 years, then you start getting penalized, if you will. That use of the EHR is going to be critical if we're going to be able to realize the dream of the patient-centered medical home. By a patient-centered medical home, this is coming out of a report that I'm going to show you in the next slide. But just to give you an idea, I had a nice dinner discussion with Charlie from P&G. Is Charlie here in the audience? Yeah, Charlie's sitting right over there, so he's an expert in the patient-centered medical home as well. But the whole point of this discussion is you have a provider that's got 300 or 400 patients, and that's who I'm in charge of, and I have nobody else except those 300 or 400 patients. And patients are willing to pay money for that, $1,500 to get that kind of quality service, if you will. But you're going to have the whole healthcare team engaged in this, and so that provider leads a team of individuals, other healthcare people. They're going to schedule your appointments. They're going to follow you throughout your growth. I mean, your aging process. They're going to get you consults. They're going to coordinate your care, get you in the nursing home if you're at that stage of your life. They're going to look at quality and safety, will be assured. And the whole point of this is, so what role does information technology, that's what we're talking about today, Digital Summit, what role does information technology play in the patient-centered medical home? And it will be an impact, I believe, on quality and safety. The confidentiality is going to be a big issue. I'm not going to give you my information unless I know I'm dealing with a secure network that's HIPAA compliant. And then the patient payments are going to be something that health IT is going to need to be very involved in ensuring that providers get proper remuneration for those services. This is that report I was telling you about. This is the Patient-Centered Primary Care Collaborative. It was published in October 2010 to look at essentially, it's a consortium of, it's an interesting document. It's about an inch thick. I've read parts of it. I certainly didn't read it all. But what's really interesting, it's got about 15 chapters in this document and then about 23 case examples that goes through all these different healthcare plans in the U.S. that looks at the role of information technology in a patient-centered medical home. And again, back to the electronic health record, if we're going to realize cell phones, telemedicine, et cetera, which is all part of the health IT plan in a patient-centered medical home, we've got to have a functional electronic health record. We're nowhere near that. Parts of the EHR is being used. You can see in 2009, 44% of physicians are quoted in this document, up from 35% 4 years ago. In terms of who is using a fully functional EHR, in the DoD we have one, the VA has one, and others like Kaiser, large health groups have EHRs. You can see fully functional, it's all below 10%. We've gone from 4 to 6%. We're still nowhere near realizing pervasive EHRs, which again, the healthcare budget that was passed, the whole program is to promote the use of electronic health records in clinical practice, which is a prerequisite for a patient-centered medical home. There have been really few descriptions of patient-centered medical home and health IT, so we are in the process of writing that literature. So in addition to cell phones, the whole movement towards patient-centered medical home with legislation now from our federal government sort of promoting EHRs among docs, the next big movement I see coming is smart bandages. How many here are familiar with that? Okay, so you guys are pretty sophisticated. I'm going to sit down and let you guys give this talk. Smart bandages are, I believe, another important area to think about. What we're talking about here is very inexpensive bandages that are wired with a little reusable radio. It has all these different sensors. They cost pennies to make. You pull them off when you're done. You wear them for about a week, just like the nitro patch, the smoking cessation patches that are out there, the fentanyl patches for pain control. You peel it off, but what it's going to do is monitor continuously EKG, heart rate, pulse oximetry, the level of hydration. If you're a heart failure patient, it'll say whether or not you're starting to get fluid overload. It'll take all this information, temperature, port that information from this little bandage through a variety of different electronic devices. So it'll be a cell phone, it'll be your wireless router attached to your computer at home. It'll be a variety of things out on the internet cloud and then used by a lot of different people. Again, I always tell the story about my 93-year-old dad and my 91-year-old mother. I'm so fortunate to still have them, but I really would love to be able to, as a family member, know how they're doing, where I can just log on like I get my email on my BlackBerry and look and see how they're doing. Are they getting out of bed? Are they heart rates are okay, et cetera? If they're short of breath when I'm talking to them, what's their physiological data showing me? So it's in addition to physicians and healthcare teams, family members are going to play a big part of this. Again, as baby boomers age, I'm going to have my kids are going to keep an eye on me when I get old. I'm just so determined to hopefully keep them loving me long enough that when we get these smart bandages out there, I'll be able to have them keep an eye on me as I hopefully see retirement years. So all these electronic devices are now going to be attached to some gateway. It goes out on a wireless network. And again, this is all happening as we speak. So that's the big push. So I talked about how cell phones are out there, how patient-centered homes out there, how smart bandages are moving out there. And so what are we doing? I'm going to give you some examples of mobile health that we're doing at the Army Medical Department because I think it's reflective of not only what's emerging, but also the civilian translation. Everything I'm going to talk about can be done in the civilian sector. This is not military unique. We have 10 million beneficiaries in the DoD, and many of you may be beneficiaries. But the point is that I have the same patient care population that most of my civilian providers. The only difference is I got a lot of them in Iraq and Afghanistan and on ships at sea and at different Air Force bases around the world, which makes it even more challenging, which is why telemedicine can link us together. So clinical consults, education, research, I'm going to highlight an example there in disease management. Biosurveillance, we've got an active project. I'm not going to spend much time on it. It's in Peru right now. We're looking at the open source, using open source software as a means to come up with a way to, with the H1N1 flu was emerging in South America,